Okay, good morning. Good morning, everyone. Today we're here to have a conversation about child mental well-being. This is a subject which is both timely and important. My name is Dr. Marla Borg-Bontempo, and I'm honored to be introducing this seminar. So we're going to be talking about child mental health today, and this is part of the national campaign called HUHSIP, which focused on mental health. This was a joint campaign from the Ministry of Health, from the Health Promotion and Disease Prevention Directorate and the Mental Health Care Services. Today we have with us a distinguished expert as our guide, Dr. Nigel Camilleri. He's both an expert and experienced in years of practice and research in the field of child and adolescent mental health. Dr. Camilleri graduated from Malta in 2003 as a doctor and continued his practice by training in psychiatry in the UK from 2008. Since 2015, he has been a consultant in child and adolescent psychiatry within the Maltese Health Service. Following his years in the UK as a consultant, he is also the clinical lead of the psychiatric services. And he is an associate clinical researcher at Newcastle University, currently working with the pediatric bipolar disorder team on research projects in this field. So this webinar will take the format of an interview where Dr. Elaine Kutayar, who's our expert in psychology and public health, will be asking questions. And this will take the form of a conversation. We will be giving you information, but also we will be providing you with practical tips, which are vital to ensure children are prepared to face the world. And we will provide with coping mechanisms and strategies. We hope that this conversation will give insight and support both parents, caregivers and guardians and educators in the field of child mental health and well-being. And lastly, Elaine will share the resources which are available for you. Your engagement is very valued. We have reserved time after the discussion for an interactive question and answer session. So we would value your joining us today and asking questions at the end of this webinar. So I'm happy to introduce Dr. Nigel Camilleri and Dr. Elaine Kutayar. Welcome, and up to you, Elaine and Nigel.
Good morning. Thank you.
Welcome, Nigel, and thank you, Mariella, for that introduction as well. So first of all, a big welcome to our expert. We are very excited to talk to you today and to ask you about your opinions and what input you might have about childhood mental well-being. So I'm going to start with a how are you first, actually, just to ask you how you are feeling today, actually.
Thank you. That's a nice way to start. I guess I am a little bit anxious about how this is going to go. But I'm looking forward to it. So it's fitting to have one busy day after the other, but I think it's an opportunity to be able to talk about the importance of child mental health. So I'm very grateful actually to have this opportunity and to raise the awareness and get some awareness out there. I think this is extremely important for most parents to listen to, get the opportunity to listen to.
Exactly, and this is why we reached out to you as well, because you're very passionate about the subject of child mental well-being and mental health. So thank you for joining us today. The first thing I want to ask is actually the starting point. What is mental health? What is it, especially when it comes to children, and why is it important that we think about our mental health for our children as well and for their mental health?
All right, so I guess mental health, as you asked me in the beginning, is how one is thinking, okay, how one is feeling, and how one behaves, and these are all linked together. So if my thoughts at the beginning of the day are positive, then I'm probably going to feel better and my behaviors are going to be better. If I'm going to start off the day feeling a little bit irritable, a little bit down or stressed, then my thoughts are going to be negative, my feelings are going to also be a bit negative, my approach will also be negative, or I might avoid. So mental health includes what is emotional, okay, what is psychological, and also social. And what is important in mental health is that in child mental health specifically, what we look at is the aim is for every child to achieve their potential in every area within their life. So that is our goal, be it physical, okay, because we do link up with physical, and I think it's important here from the beginning to say that there is no health without mental health. So there's no physical health without mental health. They go hand in hand. Over the years, we have separated them, but thousands of years ago, people would talk about healthy mind and healthy body at the same time. So there's no distinction between physical and mental health. So it's physical, but then there is also the aspects of a child reaching their potential at home, in education, outside with their peers, and also outside of education and their extracurricular activities. So that is our aim.
Exactly. So these, I think, what you said would be indicators of a child being in good mental health as well.
Yes.
The consequence of a child with good mental health, that they are able to reach their potential as well.
Great, agreed. So just to start off, I mean, why are we talking about? So why? Because I get a lot of this. I get this question many times. Why children? Do children suffer from anxiety? Do children suffer from depression? Children always are happy, is what parents tend to ask. Now, I think what is important is, in actual fact, mental disorders are the #1 cause for ill health at the ages of 15 to 25. Research done by Rosemary Sacco and Malta on a systematic review in Europe shows that mental disorders, okay, so poor mental health, affect about 1 in 8 young people, which is very high throughout their lifetime. All right, so it is present. And Pat McGorry has mentioned that untreated mental health leads to long-term morbidity and mortality. So the amount of good life years lost through mental disorders are very high. Okay, and actually mental disorders which are untreated are called, so they are as disabling as someone at a young age. So I think it is important to talk about mental health. Now, just to start off, okay, WHO mentioned five factors for good mental health. So if we do them, they don't cost money. If we do them, then we are guaranteed in a way to have good mental health. So one is to sleep an adequate amount of hours, depending on the age per day. The other is to have good nutrition. Okay. The other is have a good amount of exercise every day. And in children, it is 30 minutes to an hour, 6 days a week. To reduce the amount of alcohol, caffeine, and substances within our lives. Okay. To have a caring relationship, to have someone who supports us, being a carer, being a parent, being friends, and to give something back to society. So those factors are very important. Those factors guarantee or help us develop good mental health. Okay, so we started off saying, do young people suffer from mental disorders? And I guess you can see from this timeline here that yes, some disorders are, so neurodevelopmental disorders, they start at a very young age. As you can see, autism, ADHD, learning disabilities, epilepsy, specific language development, these all start before the age of 5, and they are present, okay, before the age of 5 years old. I'm sure parents can relate to this, having a child with hyperactivity, ADHD, struggling with attention, or having a child with a delayed speech, and that would be in keeping with autism. And also we don't have mentioned here the attachment. Okay, so early years between 6 months to 3 years are the most important, 1,000 days, which are the most important for the development of relationships and attachment. After that, in young children, we tend to see the development of anxiety disorders and obsessive compulsive disorders. Now, anxiety disorders remain the most common that we do tend to see in children. They start around the ages of 5 or 6, and then they tend to peak at the age of when child goes from primary to secondary school, which is about the ages of 10 to 11. And they also change in nature. So initially they start off with simple phobias, okay, or separation anxiety, so struggling to get to school, struggling to leave their parents. So we mentioned attachment. Eventually they become social anxiety. So in our teens, I guess we all remember being very socially aware, being very socially conscious of people might be talking about me, how do I look, body image. And this is all something which starts in teenage years. Now it's important we do not, and we'll be talking about this, it's important we don't pathologize everything. Okay, so being socially anxious as a teenager to a certain degree is important. Why is it important? Because it is the time when I start finding my place within the world. And it is the time when I start developing and becoming an adult as a teenager. Being aware of body image is also important. It becomes a problem when, for example, it starts affecting my function. So I would not go out to a party where I'm invited with my friends because of the way I look. That would be a sign that this is affecting my body image. Or I might not go to a party because I am shy of what they might say or think about me. So this is the difference between a disorder and normal development, which I think is extremely important. Okay. We then have substance use disorders, which experimentation will now start in early teens, around the age of 13, and go on to go on to the age of 25, and the prevalence goes up and up. And at the same time, we get, which is the second most common, is major depressive disorder in young people. So this is different to normal sadness, or different to ups and downs which teens get. Okay, so we get a lot of young people who come to us with ups and downs in their moods. Now, in truth, there is a big difference between waking up on a Monday morning and feeling sad because you have to go to school or you have to go to sixth form, as opposed to being stuck in bed with a perpetually low mood and feeling sad and being tearful for no reason. So that is different. Eating disorders also commonly start in our later teens, so with anorexia and bulimia disorder. And then there is also bipolar disorder and schizophrenia, which I'll talk a bit about later. Okay, so I think an important factor, starting off with what is neurotypical, we say, what is within the normal range, is recognition of our emotions. So so one thing we can do with our children and also with our teenagers is getting them to be aware of the way they feel. Okay, and without judgment. So I think it is perfectly okay to not be feeling okay, to be feeling sad. And it is also good that you have happy days and sad days. We all get those days, or also days when we're irritable. So we tend to use, as you're seeing on the screen, this traffic light system. We tend to use it a lot with children on the autism spectrum. And the reason is specifically this. The reason is it's a we call it a 5-point scale, where you get a young person with autism who might struggle to recognize emotions to describe how they're feeling. And then we link that to, as we said in the beginning, to their thoughts. So if I'm feeling sad, then my thoughts might be negative, and my behavior. So if my thoughts are negative, then I might be more aggressive today. If my thoughts are more positive, then I might be more productive. Okay, might be I can continue playing, I can do my homework, all right, and I might be less argumentative. So I think this is probably one of the first steps. We're talking about language. I think this is one of the main reasons why we are here today. We all communicate in different ways, and probably the people listening to this recording will interpret it in different ways, although the language is the same. But we assume, and this is important, that with young people, that everybody understands language in the same way, when in truth, we all have different ways of processing the information, taking it in, and also expressing ourselves. So someone might, who has better verbal skills, might be able to say, look, today I'm not having a good day. I think I'm going to stay home. I'm going to miss school. Someone else might not be as good at communicating and might start banging their feet or having a tantrum on the floor. That's also a means of communication. And I think one of the main reasons, and we can go from children into teens and also into adulthood, one of the main reasons why we have disagreements, so why there are arguments, is probably because of language, because of the way we communicate or don't communicate. Okay, so this is something we started talking about. It's probably, in my opinion, one of the most important slides. So this slide is crowded, okay? But what it does, and which I think is important, is that it delineates the difference between mental distress, having a problem, a mental health problem, and a disorder, okay? I think one of the key things, and I will start off with the disorder. I think one of the key things, and this is what I get as a child psychiatrist, a number of children come to me and parents say, my child has ADHD, my child has OCD, okay? The D is a very important part of the disorder. It's the disorder. So I might be hyperactive. I might have ADHD, okay? I might have attention deficit and hyperactivity, not necessarily the disorder, okay? And we tend to get this also in older adults. I'm not saying that older adults don't have the disorder, but, and I don't want to sound disrespectful here, but when I get someone who comes to me and says, look, I'm doing my master's, I'm doing my PhD, but I think I have ADHD. I think we look at function here, and this is what's very important in mental health. So if you are functioning at the level where you're going to work, you're in a managerial role, for example, you're doing a PhD, the chances of the disorder are a bit lower, as opposed to someone who is in education, okay, but is struggling to sit down, and the teacher is struggling to give this boy or girl schoolwork because this boy or girl is running around the classroom all the time. All right, so I think it is very important to look at disorder, okay? And we can compare this to blood pressure. This is like when someone comes to you and says, we all have blood pressure, but it becomes pathological after 140 or 190. So before that, it is within the normal range. So same with having autistic symptoms, having low moods, okay? Not everything is a disorder. So we start off with mental distress. So I think it's important. So having an exam, for example, okay, causes an element of stress or distress. Now that is important because that is where we get motivated to study. If I was not anxious or a bit worried about my exam, then I would not study and I would not prepare for it. So a certain amount of stress is what actually, so we tell our patients that a certain amount of stress or anxiety keeps us alive. All right, if we look at this evolutionary, so anxiety is a fight or flight response. If I were crossing the road, okay, if thousands of years ago, my ancestors, I would be going out hunting, okay, and a lion came to attack me, and I did not get an anxiety response, fight or flight, I would either fight the lion or run away from the lion. Now, if I didn't do any of that, I would get eaten. The same today, if I'm crossing the road, okay, and I don't get that fight or flight response, and the car passes, it will run me over. If I see a car, I would generally run away from the car, move away, move back onto the pavement. So that response is extremely important. The same with a mental health problem. So if we lose someone, okay, or we lose someone through death, through a relationship, through a divorce in the family, changing country, it is normal to have a process of adjustment, okay, and also normal to have an acute stress reaction. It does not make it a disorder. It can become a disorder if it is prolonged or pathological, okay, but it's not necessarily a disorder. In fact, and we'll talk about it, being exposed to a certain amount of stress creates resilience, makes us actually stronger. Okay. Okay, so this is a similar but maybe a better visual of what we're talking about here. Okay. So if we go through them again, just briefly. So there's no distress, no problem, no disorder. If someone is pensive, thoughtful, all right. Mental distress, as I mentioned, something happens. You might argue with a friend and you're feeling sad. You might have too much homework to do and you feel unhappy with that, or you feel a bit overwhelmed. That is mental distress. You have an exam coming up, A levels coming up. That is also a form of mental distress. Okay, a mental health problem is when something relatively serious happens in your family. So high stress factor, as we mentioned, you change country, you emigrate, your parents separate, parental separation, someone close to you dies in the family. Okay, and then a mental disorder is when your function is actually affected. So depression, I cannot get up in the morning, I cannot go to school, I cannot go to work, I don't want to meet anyone, I'm withdrawn. I used to enjoy playing football, I used to enjoy meeting my friends. I no longer want to meet them. That starts becoming a problem. Okay, and I think that is important. All right, these are the different types of disorders, which I have gone through quite a bit. I think the two which I didn't mention are the three. So you have bipolar disorder. Okay, now bipolar disorder tends to start in the later teens, and this is when you get rapid mood cycling. It is different to when someone has being a teenager. So in bipolar disorder, function is affected. If you are low, then you cannot get out of bed, or feeling very low, grumpy for a week is bipolar disorder. And then you also get manic episodes where you cannot control your behavior, you're disinhibited, and this goes beyond your regular normal function. Schizophrenia, which I think is very important. Schizophrenia has been vilified throughout the centuries. However, it is not a split personalities. Schizophrenia tends to occur also in later teens, or start in later teens, and this is distressing. This is when someone starts believing that people are talking to him, or he or she is seeing things that other people cannot see. And this is not something that they are inventing. It is something that they believe 100% that there is, for example, a conspiracy against them. And there is no other understanding there. And what we haven't mentioned is a post-traumatic stress disorder. And I think this is very important because nowadays, going back to the diagram we saw before, not everything is a trauma. And I think we need to be very clear here. A trauma is when someone is in a situation where they feel that they're either going to die, okay, whether it's so distressing that they're either going to be at risk of death, or at risk of they feel like they're going crazy or going to be killed. And so it's when you're in a situation where you feel completely out of control. So an exam does not traumatize an individual. Okay, when we talk about trauma, it will be being, for example, being exposed to being an earthquake, being exposed to a terrorist attack, the Twin Towers, being sexually assaulted or abused by someone, family member or outside. These are examples of trauma which can give rise to post-traumatic stress disorder, or being involved in a very bad road traffic accident where you felt that you might lose your life, or so you saw someone lose their life. That brings on PTSD.
Actually, that's a really, really great introduction to mental health in general, and you gave us, I think, a great overview of the differences in the dimensions of our mental health. Like you said, there are things and conditions and disorders that become persistent or consistent, and they become something that is, like you're saying, a bit more influencing our daily life. And then there are things that we witness every day and that have also an effect on our mental health. So thank you for that lovely introduction. And actually, you changed the slide over here, and I was going to ask you to continue talking a bit more about that stress that you mentioned. What kinds of stress are there? What can you tell us more about this kind of stress?
Okay, so what is stress? I think it's a very good question. stress can be this presentation to start with, yes? But I guess what's important is that not all stress is bad, okay? Linking up to what we were talking about before. So stress is a very important motivator for the brain, all right? If I weren't a little bit stressed about this presentation, then I probably would be too laid back. So there is a curve which we have, which I'm not sure. Okay, so if we're understimulated, then probably we'll not prepare for a presentation. If we're overstimulated, okay, then we would freeze. So you have fight, flight, or freeze. And when you freeze, you cannot speak. Okay, you get stuck in your description. So stress is a good amount of a physiological response to what is perceived as a challenging situation. And now what I'm saying is maybe sounding gibberish to people out there, but it's actually, when I say physiological, it's actually physical, okay? So our adrenal glands produce a certain amount of noradrenaline, they stimulate the brain, and they send blood so that my blood pressure goes up, my heart rate goes up, and my brain is receiving a certain amount of blood so that it can focus on and deliver what I'm doing right now, so I can think clearly. Okay, if I am overstressed and freeze, what happens is that rather than the blood going to my brain, it goes to my hands, it goes to everywhere else. As a result, there is less blood within my brain and I freeze and I don't function. So it is very physical. So people who try to say that mental health is not linked to physical health, that is one example where there is which doesn't hold, yes? Because this is as physical as it is psychological. Okay. So we spoke a little bit about major life events. Okay, so loss, relationship breakdown, sudden changes. Okay, we have health. All right, plays an important part. So linked also physical health with mental health, and these all lead to a certain amount of stress. All right, but getting to school every morning, keeping times, that is something which is positive stress, which eventually will make us more disciplined and more functional in society, which, as we said in the very beginning, our aim with children is to help them reach their full potential. Okay, so this is something we've been talking about. So not all stress is bad. Okay, I think the more we are exposed to a good amount of stress, and I will talk about what is good and what is toxic stress, is what helps us grow as individuals. All right, so if I link it as Nigel to someone who does sports, okay, that is physical stress. So having to run or cover a certain distance, if I start off by running 5 minutes a day, eventually I can run 10 minutes, eventually I can run 20 minutes, and I can run a whole marathon. And that is stress, and I'm building up. It's making me physically and mentally stronger. The same way, when someone starts studying, you might be able to study for 5 minutes, eventually it's 10 minutes, then you can concentrate for 15 minutes, and then you can concentrate for an hour. Okay, and that is what helps build resilience over the years. Now, the types of stress which are important, there is positive stress, is what we mentioned, and the difference between positive stress and negative stress is the way we approach a challenge. So if I
health promotion, maybe we can put it on mute. We're all muted.
All right, I think I'm unmuted now, yes? Can you hear me? Okay. All right, so back to how can we approach stress in a positive way? Okay, take this presentation again. All right, if I take this presentation as a threat, so we said the thoughts are linked to our feelings and our behaviors. If it is a threat, okay, and I think people are going to get bored, people are not going to listen, people are not going to turn up, I'm going to start thinking negatively. I start getting cold and clammy, my heart starts racing, as I said, and that becomes negative stress. All right, if I take things as a challenge and I say this is interesting, I'm going to try to make it as fun as possible, as interactive as possible, then the way I think is going to be positive, my delivery is going to be more positive. The way I feel is going to be more positive. Okay, the same with an exam coming up. If I am threatened, if I say there's no way I can pass my maths exam, and I feel that I'm no good at maths, I'm hopeless, my thoughts are negative, then as a result, I'm going to see this as a threat, and I'm going to go to the exam in a threat state. If I am positive and say, no, I have really practiced maths, I have really done so many maths examples, and I have been practicing all month, then I'm going to go in a state of challenge, and I'm going to feel better, and I'm probably going to pass the exam. Okay, as we were mentioning though, stress over time, so there is positive stress and there can be toxic stress. Okay, toxic stress is when someone is, for example, in a school, so we're talking about children, and they are constantly being bullied or picked on or teased by their friends. Okay, a little bit of bullying at school is not a problem, it makes us resilient. Okay, so we've all probably been picked at some point in our lives. But if I am constantly the person to be picked on, then that becomes toxic. Okay, if I'm the person, the scapegoat of every joke, or maybe a teacher also passes a comment, then that becomes toxic stress. Okay, the same can happen at home. So there could be with our siblings, I might be the one who's always scapegoated, the one who, Nigel, this is always your fault. You're the one who never behaves. Okay, that could become toxic. So you can be scapegoated and picked on at home. And then we mentioned other forms of toxic stress. So there could also be actual emotional abuse where you are picked on. The reason why you picked on, so we are not together as parents anymore because of you. All right, or as triangulating a child within parents who have separated or divorced. So I think always blaming, so getting the child to take sides. No, you want to stay with your daddy, or you want to stay with your mommy. That is toxic stress. Okay, so I think that's very important. And then physical abuse, so being hit, being sexually abused, so or else being neglected can also be toxic stress. The concept of ignoring, more than ignoring, being not seen within a family. All right, I think that is important. Okay, and what helps is, so what makes stress tolerable is having supportive relationships. We mentioned this in the very beginning, okay? And protective relationships. And also, it's not always about what can I get, it's what can I give back, okay? Something I can give back is important. So that I help someone, that I help the boy or the girl being bullied in class, or standing up for the person being bullied, is also helping myself in the long run. Okay, so we said stress is not all bad, and that's how we look at it and manage it. I think we're repeating here, but it's important because what came up, I mean, I remember reading a few studies and also in newspaper articles. I remember in Newcastle reading 25% of all university students are depressed. That's not true, and that cannot be true. And I think the way the press can go out there, so too much awareness is also negative. So I'm sure not 25% of university students are depressed. Actual clinical depression. They might be sad, they might be dysphoric, but that is not depression. Okay, or saying 75%, I think, I suffer from an anxiety disorder. 75% is almost everyone. That is much. Okay, so they might be overwhelmed, they might be distressed, but they're not. We don't have 75% of our youth with an anxiety disorder. That would be quite negative for our overall health of a nation. Okay, so what is anxiety? All right, so anxiety, as I mentioned before, and I think I jumped, I went ahead of myself. All right, so we talked about the fight or flight response. Okay, an anxiety disorder, all right, becomes a disorder when we start worrying about a perceived threat, okay, something which is real or imaginary, okay, which we start seeing as a threat to ourselves. And I think this is very important. So, for example, if I start believing that going to school is a threat, and my brain starts telling me that it's a threat, as soon as I start getting towards school, I am going to start feeling, as I mentioned, that response. My adrenal glands produce adrenaline. I am going to start feeling very tense, my hands cold and clammy, my heart rate beating, and I will want to go back home. Okay, my thoughts will be negative and I will want to go back home. So that is what brings on an anxiety disorder.
We really see over here the importance of that, the mindset, the mind, and how the way you perceive the stress in front of you is really one of the most important tools or weapons against stress. We don't maybe need the strength to fight the lion in front of us, but maybe that mindset is the tool we actually need. And the best thing about it, I think personally, from what we are saying, is that that mindset is something, like you're saying, free as well. So
Yeah.
we can just see what we can do about that mindset and the perceiving of the stress, and that will help us a lot. So it's nice, it's a good news, I think, to see it that way.
Yes, I think understanding it is very important, because we didn't mention panic disorder, but some people feel that they might be going crazy or going mad. Yes, when they start feeling this way, they start panicking. You walk into a crowd, you suddenly start feeling very uncomfortable and feel that you're going to go crazy. And this is not, you are not going crazy. This is a physiological response to anxiety. This is anxiety. I might not be comfortable in crowds, and that's what's happening, or I might not be comfortable in schools. But knowing what is happening is the first tool to then protecting our mental health. So knowing that this is anxiety, this is not I'm going to die, this is not I'm going crazy, but it is just a physical response to me that I am uncomfortable in such a situation. Now, what can I do? I can either stick it out and stay in the supermarket, which is crowded, or at school, and that will make me stronger. Or else I might need to walk out for 5 minutes, go to the toilet, calm down, and go back in again. Okay, and I think that helps build strength, okay, inner strength on our mental health. Okay, so over here we're mentioning so we mentioned these 5 items in the very beginning. Yes, so
Exactly,
investing.
yes. I was
Sorry.
going to ask you as well, like how can we continue to do these 5 things that you mentioned in the beginning, and how can we bring them more into our life? That was one of the questions I want to ask as well.
Yes.
So if you can give us more information, that's amazing.
Okay, I think in the same, I think we need to give our mental health priority. Okay, we'll probably, all of us here, rush from one thing to another. Okay, and then it is late at night, we fall asleep, we wake up the next morning and we don't think about it. Okay, but as you mentioned, there's how many people do this? How many people reflect, okay, at the beginning of the day or at the end of the day, maybe 3 positive things what happened in the day and 3 negative things which did not happen? I remember having a friend of mine who I actually trained with. He wasn't a psychologist or anything, but at the end of every day, he had a diary and he would write down 3 positive things which happened and would write down how he was feeling. Okay, and that, as a process of reflection, was helping him think about that the day was not all bad. This is a day which was half-filled glass, and there are some positives which did happen. Now, when you mentioned the 5 things which we mentioned before about balanced diet, I mean, I am not a nutritionist, but there's a lot of information out there, okay, on what is a healthy diet. So a mix between protein, carbohydrates, and vegetables and fruits, I think is important for everyone. Okay, sleeping enough is also very important, especially for children. So adults need to sleep 6 to 8 hours a day, not less than 6, definitely not. But children need a lot more than 8 hours. So younger children, okay, toddlers would need as much as 12 hours, 12 to 14 hours. Okay, and primary school children would need a bit less than that, and secondary school is about 9 to 10 hours. I get a lot of children as patients who come to me and say they go to sleep at 10 and wake up at 6. That is 8 hours. That is not enough. Okay, even though they're in secondary school. It's not enough, because at night is the time when hormones are produced, growth hormone is produced, and is the time when we also, when the body refreshes itself and there's growth, both physical and mental. Okay. And also we mentioned physical health, being physically active. So being physically active for children should be about 30 minutes to an hour, 6 days a week. Now there is a lot, this is the cheapest antidepressant which exists, anti-anxiety. So there's a lot of studies which link to the effect of moderate exercise. So moderate means not going for a walk, but would be raising your heart rate enough. So either an easy jog or very fast walking, or playing football, or doing a sport with friends, this is known to bring out certain feel-good hormones, all right, which have antidepressant and anti-anxiety properties. Okay, and then we're talking about a balance in our life, a balance between work and our things which we enjoy. And I think this goes to show that the extremes are never important. Okay, so neither whether it is extremes of just working all day or playing all day. And I think this goes out to all children out there who come and tell me that they wish to stay all day on their computer. And we haven't spoken about social media, but so there are positives with social media, there are positives with being on the computer, there are positives with using the internet. All right, but everything needs to be done with balance. So we say that it should be no more than 2 hours of screen time within the day, which I think is extremely important. And this is either to play games or to socialize. Okay, any more than that is you're probably losing out on other things that you should be doing, either going to school, studying, being physical exercise. So the balance, I think, in life is key.
And it shows that, again, what you said in the beginning, how there is no health without mental health, and how they are both intertwined. What you do in one, you're going to feel in the other, and vice versa. So we can see it clearly over here now from what you are telling us, how important it is to take care of ourselves physically, to be able to then take care of ourselves mentally. I'm seeing some more information about physical activity. So go ahead. Sorry for
we're going
cutting
ahead. Yes, thank you for you're going to the next slide. So as you said, there's a clear relationship, okay? And I think we need to move away from this idea that mental and physical health are separate, okay? I remember maybe having this discussion with a surgeon who was completely against having psychiatric patients around the physical hospital, around being in hospital. And when you think about it, and then I remember having this conversation, the surgeon actually runs as well. And I actually had this discussion. Have you ever gone for a run? Have you ever done a jog yourself without actually using your head to run? Yes, without actually being there. So you cannot separate the two. So to get yourself to go out for a run, you need the mental strength to push yourself to go out for a run. To keep running, you need the mental strength. And the reason why you run, so the reason for the physical, is that after you do feel good. No, there is an enhancement to your mood. And also I'm saying ADHD in the slide, okay? So a lot of parents come, and although we agree that the mainstay of treatment, the number one treatment would be medication for moderate to severe ADHD, there is a lot of evidence to show that sports, so regular sports, actually does improve concentration. It improves one's attention. So after exercise, we tend to feel happier, we tend to feel more relaxed, and we can concentrate more on a piece, on doing our homework. Okay, so this is something about stress. Okay, 3 things to do. So the stress response curve. So I think starting off, when we see this graph, what is important to know is that if we have something very stressful, okay, and this is important in anxiety, in a panic attack, or even in obsessions, OCD, okay, so there is the amount of stress over time. If I have an obsession, if I'm worrying about something, the brain tries to get me out of that distress, to get me into my comfort zone. So let's say I have a fear, let's be realistic here. So I have a fear of germs, okay? And I have just picked up a biro, which I believe might have germs. So in my head, my anxiety is going to go up to 100, and then I need to do something to feel better. So what do? I go and wash my hands. But all that has done, the brain has done, is bring my anxiety down to help me feel better. But in truth, it has not helped me with my obsession, with my OCD, because naturally, if I hold a biro, my immune system is strong enough not to get me sick by holding that biro. Okay, but by washing my hands as a safety behavior, I think I'm feeling better, but actually is leaving me as anxious as I was before. But if I had to sit with that emotion, with that thought of anxiety that I have touched the biro, but my body can defend itself, my immune system is strong enough, as you see with the curve, over time anxiety goes away. All right. In the same way, if I am worried about, let's say I'm a teenager and I'm worried about someone who passed a comment about me, okay, they say, I don't like the shirt you're wearing. Now, if I'm going to let that affect me and I'm going to go on to everyone to seek reassurance because I get very anxious and I go, but do you like my shirt? Do you like my shirt? Okay, that is going to bring my anxiety down, but it's going to leave me actually anxious because that is still a safety behavior. If I am able to sit with that thought that someone said they don't like my shit, with time, naturally, that is going to go away. The anxiety goes away alone. So I think that is something very important, okay? If you stand in a supermarket in a crowded place and you feel very anxious, if you can stick it out, then it will go away. Okay, so one thing to learn in anxiety is that when we avoid a situation, we're actually strengthening anxiety. The more we face the anxiety, the stronger psychologically we become. Okay, and this links to how we think about the stress. So if I think about it, I am stronger than it. All right, if I know what the problem is, so if I've already said this is a panic attack, I am not going crazy, then the intensity of the response goes down. Okay, I'm not going to die here. This is an anxiety situation. Okay, and the response is therefore better.
I love that you are giving these practical examples and examples from life, basically, because sometimes for some of us, seeing this graph or seeing these sort of scientific words and so on and so forth, it's hard for us to understand. So I'm glad you're giving some applications, and maybe some of us can start to maybe apply them to our lives as well and see what in our life is similar to this with our children as well. So great stuff.
Thank you. No, I understand, because I think one of the hardest things is it's easy to listen to it. It might sound interesting, but if we don't put it into practice, then probably nothing really changes. And that is probably one of the hardest things that probably I find, because even I, as a therapist, I might be doing therapy with young people here. So we're moving on to relaxation techniques here. And I can talk about relaxation techniques and taking deep breaths and listening to mindful music or listening to calming music, and when I'm feeling stressed or going out for a run. But if I don't practice any of them, then I myself am going to remain stressed, or I'm going to remain tense or overwhelmed. Okay, and not everything works for everyone. Okay, so I myself, when I was probably the first time I did a mindfulness exercise, so listening to, for example, some relaxing music and trying to be in the moment, that is mindfulness, and not judging myself, I probably found it very hard to concentrate. Okay, years later, probably I can listen to a relaxing or a mindfulness exercise, and still, maybe after a minute or two, my mind drifts, and that is normal. Okay, but I think it's important that each and every one of us find our own coping strategies, and we'll talk a bit later on about coping strategies. Okay, so now moving on to recognizing the problem. Okay, so I think this is quite important. Saying, is there a problem? Okay, so what's happening? Is there something that I could change, or is there something that I cannot change? All right, and also sometimes it is accepting things which I cannot change. So if I'm going to school, I cannot change the other boys and girls in my class. Okay, what I can change is myself, and this is something I do work with young people on. So they come and tell me, oh, but I don't like the way my mother talks to me, I don't like the way my father talks to me, and I don't like the children in my class. Okay, or I want them to stop calling me names. Let's say it's bullying. I think it's very hard for me to stop what other people are doing. What I can do is I can change myself. Now, if I'm doing something to attract negative attention, if I am making a noise in class to attract negative attention, if I am saying certain things, then probably that is something I can change. So in truth, I can only change myself, is the way I see it. I might be able to convince some close people around me to change certain things, but I cannot change characters or people. So probably it's accepting what I can change and what I cannot change. And sometimes sitting through a situation, sitting through a class, which might be, I consider, let's say, a lesson which might be very boring, might actually teach me to self-control, to improve my distress tolerance, we call it. Okay.
These are really good questions. I suggest if there are any parents here who are interested in maybe showing these kinds of questions to their children and maybe even writing them down, and maybe we use them as a checklist when stress happens. These are wonderful questions to be asking yourself at these times. I'm seeing more here.
So something else which we talk about is putting things into perspective. Okay, and we call it, there's a badness scale of 100. So someone might say, oh, I really feel bad because I have to wear my uniform and I don't want to go to school because my uniform is so uncomfortable. Okay, but let's put this on a scale of 0 to 100. Okay, and they say, how much is it? 0 to 100. Oh, wearing my uniform is 100. I hate it. 100. Okay, now what if, for example, so how much would you rate if, for example, your mother or father got sick? Oh no, that's 100. Okay, so how much is not wearing? So how much? So now, how much would you rate your uniform, wearing your uniform on 0 to 100? No, in comparison to my parents getting sick, I would say that is 20 on 100. So that puts things into perspective, yes? Or for example, I really hate this life because someone is bothering me. Okay, and how much do you hate it? No, I hate it 10 on 10. Okay, now if you put it into perspective, what if you had to wake up one morning and unfortunately you get sick with something, you get sick with a chronic disease, or you get cancer? Oh no, that would be 100. So if you compare it, then that is different. Or it's looking into the future. Okay, so sitting next to a boy or a girl who you don't like in class and feeling very distressed. But next year, how much would that really affect you? Or 10 years' time, how much would that affect you in your life? And something else we tend to find is when I ask people, especially people who are depressed, how bad do they think they are? No, I'm the worst person on earth. Okay, putting things into perspective. I'm a really bad man or a really bad boy. Okay, but realistically, if we say, compare, let's say, so how bad are you? 10 on 10. But if we say, and how bad do you think Hitler was then? Oh, no, Hitler was much worse than me. Okay, so then you put things into perspective. Or else, can you mention something good about yourself? And children struggle to mention something that is good about themselves because they tend to talk about bad things. We tend to hear bad things. Oh, I'm bad at maths. Oh, I'm not cool enough. Okay, but what is something which is, if you mention something good about yourself, can you mention something good? And children tend to struggle. And I would say, but if your best friend were here, if your friend were here, what would they say about you? And let's say I'm kind. They say I listen. They say I'm funny. Okay, so this might be ways of recognizing things which are good about ourselves. Okay. Now the other thing is, which we've spoken about, is recognizing our feelings. A number of children come, or parents bring them in because, for example, they get into fights, or because they get into physical fights with their parents or with their friends. Now, it is okay to feel angry, and it's okay to be aware that it is anger. But I think what is important is the way we use our energy. So it is not okay for me to hit someone. In our society, it's not acceptable. Okay, if I were to right now get up and punch someone, okay, I probably will have the police come to the door and arrest me. But if I am angry, then it's what I do with it. And this is what we were mentioning before. So if I'm feeling angry, if I'm feeling stressed, then maybe I need to go for a walk. I need to go for 5 minutes to the bathroom and come back. Okay, I might need to go for a run. I might need to go for a swim. I might need to go and listen to some music or do some of the relaxation techniques we mentioned before. Okay, so it's important that we recognize our emotions. Our emotions don't always have to be positive. They can be negative. But our actions, we are still responsible for our actions. And that is something we can control. Okay, so something else, and this is maybe, it's easy to say it, building healthy relationships, but probably one of the hardest. Okay, how many of us tend to have toxic relationships or tend to be attracted to the negative person? So as humans, we tend to pick out the negative from all the positive. So let's say this webinar this morning, even if I receive 99 positive comments and 1 negative one, I will probably remember the negative one. And that is the human brain. Yes, selective abstraction, we call it. We tend to always remember the negative comment as opposed to the 99 positive ones. And the same here with healthy relationships. So when we're making friends, so we might feel that I get children who tell me, nobody likes me in class. Nobody. No one says, and then I ask the child and I say, why is that? They say, there's this one boy who's picking on me. Okay, but what about the other 20? No, I think the other 20 are okay. So it's not nobody likes. And who do you want to make friends with? And especially younger children, they tend to try to make friends with the bully, with the negative person. But in truth, that is something we can look and learn. We can say, there's no one I can be friends with. Well, there's one person who doesn't want to be friends with you, but there are 20 others who maybe are ready, who are ready to play with you. And I think it is recognizing that. And this starts with children, and it can move on also into adulthood, where we tend to want to get appraisal, or we want to get positive remarks from someone who is actually maybe toxic in our lives, when there might be other people around us who are supportive. Okay, so I think it's very important to be aware of this. This can be in the place of work, it can be in school. Okay, so looking for those supportive people as opposed to that person who puts us down, and we are trying to please the person who puts us down. Okay, so we touched on mindfulness, and mindfulness is another technique we tend to use to cope with feeling overwhelmed. So our brain is constantly full of things. Okay, mindfulness is not having a full mind. Mindfulness is being able to focus on one thing and being in the present and trying to move away the judgments which come here. So if I'm giving this presentation right now and I'm thinking about what I had for breakfast this morning or what I'm going to do this afternoon and worrying about what I have to do this afternoon, then my mind is going to be so full that I'm going to get confused and not speak, or else not make sense when I'm speaking. Okay. If I'm able to focus completely on what Elaine is asking me and on this presentation at the moment, then I can be in the moment and I'm going to be less stressed. If I'm going to be worrying about this afternoon, I'm going to start making myself more anxious. And the same can happen when I am in a maths lesson, when I'm in a Maltese lesson, or an English lesson. If I am worrying about the exam coming up in a month, I cannot do anything about the exam which is coming up in a month. What I can change is the present only. So if I'm in a maths lesson, rather than worrying about the maths exam in a month, I can choose to listen to the teacher and understand this maths concept now. Obviously, in the long run, this is going to help me because I am then going to understand the maths concept, which I can use for my exam. So that is the concept of mindfulness. The same with traffic. I guess we all complain about traffic in Malta, me included. Okay, now we can either sit in a car for 50 minutes and get really nervous, and the minute someone cuts us off, we start swearing at them and getting really annoyed at ourselves, at the wardens, at people in the street. Okay, or else, for example, choose to be at one in the moment. And we can do that by putting on music, which might be calming. We can listen to a podcast, which we can focus on. We can actually think specifically about what we can problem solve within the car. Now think of a meeting we're going to have and problem solve. Okay, or else we can just be mindful. We can be mindful of the things going on around us and be present with the things going on around us.
That's actually quite fantastic, actually, because some of us, when we think of mindfulness, I think we just think of locking ourselves up for hours and meditating, which is great. But there's an easier way to be in the present. So that's great to see, actually.
Yes, and in truth, it is hard to do for a long time, okay, but we can actually do this when we're in certain situations. So rather than just drifting away into anger, for example, in traffic, we can use a few minutes to be very aware of what is happening and being in the moment and being in touch with ourselves. And the same, for example, can happen before going to bed at night, being mindful. Okay, so we can take a few times during the day and trying to move away the judgments that come and just being present. Okay, mindfulness takes practice. So as I mentioned before, the first time probably I did a mindfulness exercise, within a minute, I probably thought 20 times of something else. So I guess the more we do it, the more we are able to practice exercises on mindfulness, the longer we can probably last being in the moment. Okay, an example, a very practical example of what mindfulness is we can look at so I look at my 5-year-old or my 3-year-old who is in the moment. He's not worried at all about what's going to happen in the evening. He's very into the game he's playing right now. Or the same, like if you have a pet, okay, a dog is constantly mindful. They're not worrying about what happened before, or not worrying about their future, but they're usually in the moment. If it is too hot, they just lie down and rest. No, if a dog wants to run or get up, then they get up to run, and they are in the moment. And that is an example of mindfulness. I guess we all started off being mindful as toddlers, and we lost it along the way. All right, so these are examples, okay, which can be used as mindfulness exercises. There are breathing exercises. There's a body scan, which if you Google body scans online, can take a few minutes where you focus on different parts of the body. Being aware of our sensory awareness, okay, the temperature in the room, the sounds in the room, the noises that go on around us. I mean, we live on a very busy island, so it's good to be aware and how these noises and smells and sounds affect us. Some sounds can make us a bit more irritable, some sounds make us a bit calmer, and that is why, and we haven't had time to talk about green space and blue space. Green space is being in the environment, so going to the countryside, which has been linked to positive mental health. Okay, so we do tend to feel better if we are in the countryside as opposed to being in built-up areas, and I think that's important for Malta. And blue space is something we have a lot of, which is being next to the sea. Okay, or doing something. We can easily get to the sea probably within 10 minutes of most parts of the island, and spending time being by the sea is known to have a calming effect. All right, there's coloring, writing, listening to music, which we've spoken about. Okay. All right.
Yes, actually, I'm quite aware of the time
I'm
now.
aware of time, yes. So I don't know if you want me to wrap up with resilience and then we'll stop with resilience.
Yes, just a bit. I was going to ask you, you mentioned it actually before, the idea of resilience and the fact that you wanted to touch upon it as well. I think this would be a good roundup for the session, and then maybe I'll do a little bit of an exit, and then we'll have some time for questions.
Perfect. Okay, so what is resilience? Resilience sounds like a very complex word, okay? But resilience is probably what has kept us, it's the difference of what has kept us alive here today. They are coping strategies, okay? So as we said, that's why shying away from stress is not ideal for our children. So if our children are suddenly slightly distressed because of an exam, if they are distressed because they're being picked on in class, okay, or there is mild bullying is what I'm saying, or they have a challenging situation because they feel uncomfortable in crowds, or they've got a race coming up and they don't want to face it. I think facing it is what builds resilience. Avoidance is what reduces resilience. If every time I have a challenge, if I was invited to this webinar and I said, no, I'm sorry, I feel uncomfortable talking in public, okay, I probably will never be able to face that. So this we've seen probably public health saw in COVID, we saw a lot of people, we avoided, but we were asked to avoid, we were asked to stay home. But if we never went back to school, if we never went back to our workplace, then that is avoidance, and that is when it becomes pathological. So building resilience, okay, over time is believing that my body is strong enough now to cope with going outside in the world, okay? And there are coping strategies which we have mentioned along the way, which make things better, all right? I think exercise is probably one of the best coping strategies. We then have art, music, okay, and basically it's facing our facing our threats, but we see them as challenges.
Are there any tips that maybe you can give in the long term that maybe parents or guardians or educators can maybe just think about, just a few pointers as well?
Yes, I think tips from this session on mental health literacy. Not everything is a disorder, okay? A certain amount of distress. There is no life without being any distress. Okay, we all have our ups and downs, we all have our good days and our bad days. Okay, it doesn't create a disorder. It will actually make us stronger facing the challenges of everyday life. I think that is the first thing. Then recognizing our own emotions are very important, recognizing what we are feeling. And it is not as simple as happy or sad, okay? There are many in-betweens. Feeling disgusted, feeling on edge, feeling overwhelmed. There are many ways of describing emotions and being aware of that. And then what we are doing with the emotions, okay? So if every time I am distressed, I end up shouting or I end up hitting someone, then that is probably something I need to address. So my behaviors need to be restrained, or I need to get my negative emotions out in a different way. So I think it's what we do with our emotions that is important, something that we could use.
Exactly, how we manage stress. So that's what we're saying. It's really interesting. Thank you. I'm not sure that you have any more pointers that maybe we could think of for parents and so on and so forth with regards to building resilience and sort of building the skill aside from the sports and the physical activity and these wonderfully important things you mentioned.
I don't think anything else comes to mind apart from the 5 tips that we're saying. So then obviously good sleep, good food. So these are the things which will then help us prepare us to face the day-to-day life. But I think it is not shying away. Okay, not everything is scary out there, because I think as a society we've moved from, we were children, I was a child who played in the streets quite a lot, and now we have moved to, yes, the roads are busy and Malta might not be as safe as it was before, but the only way for our children to build resilience is if they are exposed to safe places. Yes, if they do meet people their age, if they do go out and meet people their age, if they do join sport groups or music groups, youth groups, and they are exposed to socializing. I think that is the way to build a robust and disciplined individual.
Exactly, that's fantastic. So with that, I think I'm going to wrap up right now. So thank you very much, Nigel, for your expertise today and what you have told us. I'm just going to give a little bit of a bit of last information before we cut off for the questions. There are a few resources that are available on the website mentalwellbeing.gov.mt. I think there was a slide further on it. I'm not sure that maybe Nigel you can put on the slides for the website as well. Later on, I think I had sent you a slide for these kinds of resources on mentalwellbeing.gov.mt. I suggest that go back maybe.
This one?
Yes, those. I think it would be great if participants or people watching can maybe go and have a look at the website and see how you can get more of these very, very important habits into your life, just so that you could start to build those habits slower. Those would be the resources that would be available as part of the campaign that was mentioned by you, in fact, earlier, how important it is to invest in those habits. But otherwise, thank you very much for your expertise. And now I'm just going to open the floor maybe for any questions that might be coming from the audience. If there's anything that sparked some curiosity for the audience, please go ahead and ask a question right now. So would there be any questions? How can I check maybe the chat? Oh, yes, there's a question, Dr. Mariella, actually.
Hello, hi. So Dr. Camilleri, you rightly linked kind of parents with their children, and we know how parents and children are rushing around all the time with things like extra lessons, extra sports activity, dancing, etc. Would there be 1 or 2 things that you would ask parents to think about or to try and put in place to help their children within this kind of more chaotic society that we live in at the moment? Thank you.
Thanks, Dr. Mariella. I think it's a very important question, and I'll be honest, it's not the easiest answer. So last night I was talking to my wife, who said that she had been in traffic from 3 to 7 o'clock, taxiing our children. So I guess part of it is being aware of the distress. Part of it is what we do with our time. Okay, as we mentioned, techniques of being there, because some things are not unavoidable. Yes, so cars are not going to disappear overnight in Malta. So accepting what we can change, accept what we can't change, I think, is the first thing. But also not working ourselves up, because if traffic is part of our country, then that is something adjusting to. But then it's also finding the right balance with our children. So if we're doing extracurricular activities, we don't need to do 4 or 5 a day or one every day. Okay, I think it is being realistic. So I tend to meet a lot of children now who might be involved in 5 or 6 activities. And it might be too much, because this obviously requires a lot for the parents and also for the child, because the child is getting tired. So I think it's finding the balance. So accepting what we can change and what we can't change. It is finding the right balance for our children, because we don't need to push them the other way and do too much. Okay, and then also finding alternatives. So, and this might be a cultural change, but for some reason I find myself, and I notice that as a country or as a person, I am a lot less active in Malta than I am abroad. I tend to walk when I lived abroad a lot more, or catch public transport, or use public transport when I was abroad. The weather wasn't better in England, it was worse. So if, for example, talking about the same situation yesterday, rather than spending 45 minutes in traffic to move 1 kilometer from point A to point B to drop off one child and then the other, maybe consider walking this 1 kilometer. But that involves a big cultural change, I guess. Yes.
Thank you. I think that was a question from Mariella, wonderfully answered. Is there anyone else that maybe would have something on his mind they want to get Nigel's, Dr. Camilleri's expertise about today? That's great. I mean, if people don't seem to have any additional questions, I feel like we gave a lot of food for thought here as well in that case. But so that therefore, thank you, Dr. Camilleri. Unless there are any more questions, I checked the chat. It doesn't look like there are any further questions. So thank you very much. I think I'll leave it in Dr. Borj-Bontempo's hands to sign off for us today. I'm very happy to have been here, and I'm very happy to have spoken to you, Dr. Camilleri. Thank you.
Thank you for the invite.
Thank you. So thank you for joining us and for your expertise, and good morning, everyone. Thank you.
Thanks.
See you.